as with any surgery, doctor, there are benefits and risks. We obviously know the benefit here. What are the risks when it comes to this kind of surgery?
Sure. For an implant reconstruction, you're obviously using a foreign body. So if you have needing more other kind of treatment for your cancer, like radiation, you're at a higher risk for having a complication like an infection down the road. Obviously, having an implant also has a higher increased risk of having scar tissue and things like that in the future. Using your own tissue has the benefit of obviously using your own tissue, so there's no foreign body. But in the future, down the road that might be better, but it's a longer procedure because sometimes it can take 4 to 6 hours, and it's a longer recovery time overall. And it's not something that everyone goes through. And I think the most important thing for all patients to recognize is that whatever option they choose should be the one that sort of fits best for them and their life and what their ideas are. And there is really, at the end of the day, no right option.
And also the fact that when patients decide whatever option is best for them, they also, or you have the conversation of there will be a different look, a different feel for that matter.
Yeah, for sure, and thank you for bringing that up. Obviously, they're not going to look exactly the same as they did before. Our goal as plastic surgeons is really to sort of help the patient get back to where they were before, and sometimes we're not always 100% in being able to achieve that, but we do our best to sort of get them to be a point where they're happy and confident and be able to go out at the end of the day and be just okay with their lives after all of this. And you did bring up an interesting point about feel. Mm-hmm. And what I always tell patients, the most important thing during this whole treatment is that the treatment is to really remove their cancer so that way they can survive. What a lot of times people don't talk about is that when they remove the breast tissue, they remove the nerves that give them sensation to their breast and their nipple, so that way they'll never have sensation again. One of the things that actually happens is that sometimes patients can't feel hot and cold, and we do warn patients that, be
like when
careful.
They shower.
Exactly. When they shower, when they're cooking, they just have to be really cognizant of how cold and hot because they lose all that sensation.